Hey folks, I see everyone's starting to hop in onto the webinar, and we'll get started in just a few seconds so we can allow everyone to get into the room before we start up. It's happy Thursday, hopefully, for many people. Okay. And I'm Shannon Mong. I'll introduce myself in a moment, but I'm monitoring here to see participants rolling in, which indicates to me, everyone joining. I'm going to wait to see that number stops, and then I'll get started. It'll probably be about 15 more seconds. It's looking pretty steady now. So we'll just assume that we got most people in, and those who are coming along will join us. So officially, I'll just go ahead and say good morning to everybody and really welcome you and thank you for joining us today. This is really part of the culmination of the California Healthcare Foundation's Community Health Workers and Promotores in the Future of Medi-Cal project. My name is Shannon Mong. And through my firm, Insight Associates, I've been really privileged to lead this effort to support California's managed care plans as they integrate community health workers and promotores into their Medi-Cal programs and services. But before we get started, I really want to acknowledge that as we talk and we think about the community health worker and promotor workforce, to just say out loud that we're really building on generations of work that has been done around the country and really around the world by community health workers, promotores, community health representatives, and many others by different titles. And it's really the legacy of their work that makes it possible for us to be here with you today. So here's how we're going to spend our time with you today. We're going to have an agenda pop up in a moment. And here we go. So in just a moment, I'm going to introduce today's speakers. And after that, members of the project team will provide a bit of background about this California Healthcare Foundation project, including why the foundation chose to fund this work. And then we'll describe a bit about what we accomplished, including an overview of the newly released, we're excited, online resource center and guide. And then several panelists would join in to share a bit of their perspective about the critical community health worker and promotor workforce. And we'll wrap up then after that with some responses to your questions. So just to know that in preparation for that Q&A that we'll have at the end of today's session, we invite you to submit questions at any time during the webinar using the Q&A box that's in the bottom middle of your screen. And Nayeli, if you can show the slide that shows a little, there we go, great. That shows more or less a queue that we want to get Q&A questions from you throughout the webinar. Okay, so I'm really honored to introduce our panelists today. Each of them have really contributed significantly to this project over the last year. We're joined by Alex Fajardo, the Executive Director of El Sol Neighborhood Educational Center. It's an organization that provides training, consultation, and contracting services with the promotor workforce. And I'm just going to ask that you wave your fingers or something, Alex, as I introduce you. There we go. Yeah, who's Alex? There we go. And then we have Joseph Calderon, who's also joining us. And Joe is a senior community health worker and trainer with the Transitions Clinic Network, where they've developed an evidence-based model for integrating community health workers into primary care practices. This really serves the unique needs of the reentry population. So there's Joe. We're also really pleased to be joined by Dr. Lakshmi Dhanvantari, who's the Chief Medical Officer for the Health Plan of San Joaquin. I see you there. If you wave your hands, there we go. Great. I'll take a moment also to introduce our presenters today. First, Carlina Hansen, the Senior Program Officer for the California Healthcare Foundation, which sponsored all of this work. Carlina's portfolio of projects at CHCF have focused on strengthening the health workforce, including community health workers and promotores, to really increase health equity for all. Next, we have three core members of our project team here with us today, and those include Nayeli Chavez, a senior consultant with Health Management Associates, who served as project coordinator. And we also have Kathy Moses and Logan Kelly, respectively a senior fellow and senior program officer with the Center for Healthcare Strategies, who together with others from CHCS compiled and produced the Resource Center and Resource Guide for this project. So Carlina, I'd like to turn it over to you to share just a little bit of the background on the Community Health Workers and Promotores and the Future of Medi-Cal project, as well as a little bit about the foundation.
Great, thank you so much, Shannon. I think many of you are familiar with the foundation. Just briefly, the California Healthcare Foundation is a healthcare philanthropy that is based out of Oakland and Sacramento. We are dedicated to advancing meaningful, measurable improvements in the way that the healthcare system provides care to the people of California, particularly those with low incomes and those whose needs are not by the status quo. 1 out of 3 Californians lives in or near poverty. Because people with low incomes face the biggest health burden and the greatest barriers to care, our priority is to make sure that they have access to high quality care. We recognize the historical and continued oppression experienced by Black, Latinx, Asian, Pacific Islander, Indigenous people, and other racial and ethnic groups. That is why we also work to create a healthcare system that is designed to redress and not perpetuate the inequities that too many of our fellow Californians face. One of the best opportunities that California has to advance that work is to strengthen Medi-Cal, the cornerstone of California's safety net. Our work in Medi-Cal is focused on getting people covered, making care just, and delivering better care. So when we began this work a year ago, we knew 3 things. First, we knew that research shows that community health workers and promotores, because of the cultural connections and life experiences that they share with the communities they serve, can play a really critical role in addressing health disparities. They can help California move the needle on health equity in ways that our health systems have struggled to do for decades. We know that managed care plans and providers who work with community health workers and promotores in the context of Medicaid consistently achieve improved health outcomes, reduce barriers to care, and show a high return on investment. Secondly, we anticipated that CalAIM planning would resume after COVID-related delays. As many of you know, CalAIM includes 2 mechanisms: enhanced care management and in lieu of services, or community supports, that incentivize an interdisciplinary, coordinated approach to caring for high-need patients. Both enhanced care, ECM, and community supports present opportunities to include community health workers and promotores. Third, we know that change is hard. Transformation is hard. Moving from a healthcare system that is designed to pay for illness to one that is designed to pay for health can be a challenging and sometimes confounding process. However, we were seeing many organizations that were already walking the road hand in hand with the community health worker and promotor workforce. So we brought them together to share their knowledge and to give you a head start. The Community Health Worker and Promotores in the Future of Medi-Cal project was designed to have a specific impact. We wanted to help Medi-Cal managed care plans and their partners have access to both strategies and practical tools to integrate effective, evidence-based community health worker and promotor services, with the overarching goal of advancing health equity. Shannon Mong and Nayeli Chavez are going to briefly walk through the project, and then Logan Kelly and Kathy Moses from Center for Healthcare Strategies will describe the resources that we are very excited to share with you today.
Great, thanks, Carlina. So before we actually dive in and talk a little bit about this specific project, I think it would be helpful to share a few things that everyone really needs to understand about the value of this workforce of community health workers, promotores, community health representatives, and many others who have different titles. So one of the things to know is that the workforce typically does not hold a clinical license. Instead, the expertise of this workforce is gained from life experience. It's based on shared experience in a community, often a shared cultural background with populations that are served. The goal of a community health worker and promotor is often to address a person's social determinants of health. They endeavor to understand the whole picture of a patient's life. And their tasks and schedules, regardless of the setting in which they work, are typically structured so they're able to spend more time with people in home, in the community, and in clinics. One of the things to know is the approach of this workforce is really to build trusting relationships that are based on shared power. And as you might expect, community health workers and promotores hold core values that are based in equality, justice, and empathy. And finally, their unique connection to the community and their trusting relationships with that community mean that this workforce is very well positioned to mobilize a community to deal with macro issues, as we've seen so many times during COVID. So because of this unique skill set, community health workers and promotores are really well positioned to play a key role in providing new CalAIM services to Medi-Cal members, along with other types of high-value services. So something that you should know that we knew at the start of the project was that we are not the experts. All of you are, as well as the stakeholders that we assembled. And that really is why we did assemble a large group of stakeholders so that we could achieve the goals that the foundation laid out. We pulled together more than 30 stakeholder organizations, including managed care plans, community-based organizations, training organizations, county health departments, and of course, the community health worker and promotor workforce. And over the course of a year, we held multiple meetings with our stakeholder groups, and they really helped us to identify information that would be important for a plan to know as it integrates or grows this workforce. So I'm going to turn this over to Nayeli Chavez to share a bit about how we developed the resources.
Thanks, Shannon. So we asked the project contributors to share their answers to multiple questions. So we asked, what has worked for your organizations and communities? Where have you gotten stuck, and what would your organization do differently? What questions should a managed care plan ask as they seek to integrate CHWPs into their programs and services? And also, how can MCPs and their partners hire, train, and sustain this critical workforce? We gathered information from local and national subject matter experts, including consultants within my firm, Health Management Associates. The Center for Healthcare Strategies then pulled all this information together with research, as well as new insights we gathered from local and national subject matter experts during stakeholder meetings. Our local stakeholders, including Joe and the other community health workers and promotores, reviewed and commented the resulting work. We repeated this process 4 times over the course of the year, an incredible year that it was, and the team has now refined and brought all these learnings together into an online resource center and companion downloadable guide called Advancing the Community Health Worker and Promotor Workforce in Medi-Cal. My colleagues, Kathy Moses and Logan Kelly from the Center for Healthcare Strategies are going to walk us through both right now.
Great. Hi, everyone. This is Kathy Moses with the Center for Healthcare Strategies. As Nayeli mentioned, our team tackled each of the topics that stakeholders has identified were critical to address. These 4 high-level topics are listed on the slide and include developing and financing programs and partnerships, establishing roles and recruitment, training and supporting the community health worker and promotor workforce, and engaging community health workers and promotores in collecting data and measuring outcomes. We then assembled the most useful information and practical advice on each of these topics into separate resource packages that were extensively reviewed by local stakeholders, as well as national subject matter experts, including project contributors and consultants from HMA and other organizations. Then we distilled all of this information into a comprehensive online resource guide, resource center, and a companion resource guide, which Logan's going to walk you through now. Thanks.
Great, thank you, Kathy. So the online resource center and the companion resource guide, and that resource guide is what you'll see pictured on the slide here. They are really designed to be comprehensive and user-friendly hubs for all of this information. The Online Resource Center is really an abbreviated version of the comprehensive and downloadable guide. And the website to reach both of these resources is listed at the bottom of the slide, and that is chcf.org/CHWPs -Medi-Cal. And just a few examples of some of the special features in the downloadable guide include, next slide, please, a curated list of comprehensive tools and resources. And these include sample job descriptions, training guidelines, and program evaluation and return on investment or ROI estimator tools, among others. Next slide. And then there's a program design checklist, which is a checklist that all managed care plans can use as they work through the processes of developing a new program or refining an existing program to include CHWPs. Next slide. And then there's a newly developed crosswalk to help you identify the roles and functions that are already a part of managed care services and that could be effectively managed by CHWPs within California's CalAIM Enhanced Care Management Program. Next slide, please. And if you're not sure where to begin, we definitely recommend starting with the Online Resource Center, and that's as pictured here and available again at that same link that's displayed at the bottom. And we recommend exploring the resources that are available, and then you can dive into the full resource guide based on what you find most relevant to your work. We are really proud of both the Resource Center and the guide, and we hope that you find it useful at whatever stage of your organization's journey you are at. And now I'll turn it over to Shannon to introduce the panel discussion.
Well, thank you, Logan and Kathy, and for all of the amazing work of your team, because the product is amazing. We're a little biased, but we think it looks great. So hope you're all interested. And I did share, just so everyone knows, there was a question about how you can access all the materials, and we'll be sharing some of that information at the end of the webinar as well. So just you can look for that in chat. So now I want to go ahead and turn to Alex Fajardo, Joe Calderon, and Dr. Lakshmi Donvantri to speak briefly about their experience with the project and also how these resources relate to their work. During this time, Carlene is also going to join toward the end when we move into Q&A. So just keeping in mind that you can submit questions using that Q&A box at the bottom middle of the screen. We're going to have ample time for your questions, so it's really great if you can send us those. And let's see, Alex, I'm going to go ahead and start with you. So I'm kind of curious, as the leader of one of California's Promotor workforce organizations, what do you consider as particularly valuable in the Resource Center and the guide?
Thank you, Shannon. Happy to be here. And I think this is very helpful for managed care plans who are just starting this path of integrating CHWs promotores in their workforce. So it's a decision making, a decision that they need to do about whether to hire and train this workforce directly or to contract for these services from field experts. I think there are pros and cons to each approach. It depends on the capacity of the plan to hire, train, and supervise a workforce that performs roles that may already exist in your agency or organization, but may deploy and performs in ways that they don't look familiar from a clinical settings. So they come from this perspective from the community. So it depends on the resources and relative strengths and weaknesses of your current workforce. So it depends on the needs and the population that they serve to. So it's different paths that they can take.
Okay, thank you. Thank you very much, Alex. So Jill, could you talk to us a little bit from the perspective of a community health worker about why investments in a community health worker and promotor workforce can really make a difference in patient wellness?
Definitely. And I also want to share with everybody that, today is my 11th year that I've been home after almost 20 years in prison. And now to the question. And I just wanted to share that with you. It's a strong anniversary. It shows you that those of us that come home can be assets to the community and a part of the solution and not the problem. One of the most important functions, though, of a community health worker is being a bridge to care. The populations we work with are typically the hardest populations to reach, and generally because the community in question has good reason to untrust the health system. Whether we have a shared cultural background, or in the case of Promotores, or a shared experience with the community, as in terms of peer workers or community health workers, we have a shared foundation to build a trusting relationship with the patient. And that trusting relationship makes it possible for us to gather more accurate data for the teams that we work with, as well as plan and contribute to ideas and interventions that will work for each person in their unique situation. And that's really, really important to make it unique to each care, right? This is absolutely one of the core values and propositions of the community health workers and promotores. Thank you.
Thank you, Joe. And I so appreciate that you shared this anniversary. I knew you'd been back for more than a decade, but I didn't realize today was literally the 11th year. It's a really special day. So thank you for sharing that. Lakshmi, as the medical director of a local health plan, you have a responsibility for looking at the big picture. You really know that good data and measured outcomes are critical for understanding how we can transform our health systems. So I'm curious, as someone who also contributed to and reviewed all these materials, could you share the important perspective that the 6 participating managed care plans contributed to the materials?
Yeah, since you brought up the issue about data, there's a lot of really good materials and tips for the health plans. But I think something that's really well described in the resource guide is the data collection challenges that are faced by health plans. I think most of the health plans express that. So as a health plan, we'd really like to move, and especially working on the clinical side, we'd really like to move beyond the claims and encounter data and get as close to the clinical data as we can. And when the community health workers are involved, when they are brought into the picture, they can really help with collecting meaningful data. They can help with the health risk assessments. And even at the end of the project, if we want to look at the outcomes, they can really do a brief outcome survey for us. And that can be included as part of what they do, even if it's a simple questionnaire that they can implement for us. It would give us so much meaningful information about the projects. So I think that's what was really exciting. And the other gap that they can bridge for us is between the medical and behavioral health. There's always a gap in terms of collecting information and seeing the person as a whole. And we really feel that with the use of community health workers in these various initiatives, they can really bring that perspective where they can combine the 2 data sources for us.
Wonderful. Well, thank you so much for that, Lakshmi. One of the things we thought would be really helpful today is to really open this up a little bit to some questions and have an opportunity for all of you to ask about what these resources are like and ask our panelists who are so well informed, about this topic, rather than just assume that we know exactly what you want to hear from us. So what we're going to do is open this up, and I'll respond to a few questions that we've already seen from the audience that have been submitted for this panel and Carolina Hansen. If needed, any of us can also come on board from the project team to answer questions as well. So Naili, I'm going to turn it over to you to kind of go through the Q&A and let us know what question you've seen so far for this panel.
Yeah, I'm happy to start. So we have one that's going to be very easy, and Shannon, I think I'm going to ask you to fill it out, but folks were asking if we could provide a list of the key stakeholders that were involved in our project.
Absolutely. So we have a list of all the stakeholders that's actually within the Resource Center. We have it also on a project microsite that we have where you can go, and we'll put that information in chat as to how you can look up our project microsite. And we have the list also, a whole comprehensive list, not just of the team and the stakeholders, but also the many individuals who contributed to the project in other ways. And that's in the resource guide. But we've wanted to make this very transparent to everybody, everyone who's engaged in the project from the time that we launched. So if you want that information, I'll be sharing my email as well at the end of this webinar, and you could always email me, and I'd be happy to email back if you can't find it in any of those resources. Okay.
Thanks so much, Shannon, for that.
Sure.
And we have a question as well. There is somebody that is hoping to introduce community health workers as an outreach unit in a clinical setting. They have different QI projects in mind, and they really want to build out a solid foundation. And their question is, what could be provided in regards to guidance to build a solid foundation? Does this include any trainings for the CHWs that are going to join their clinical setting? I don't know if CHCS wants to speak about how the resources available can help that person set that initial foundation.
This is Kathy. There is a section in the resource center and resource guide that talks about training. There's actually, I'm presuming you're in California, a listing of many different resources within the state that provide training from community college to or other community-based organizations. And so that might be a really great place to start. And we can pop that link in the chat just so you know exactly which part of the resource guide that is. So it's a great question and good luck.
Thanks so much. And I love to pivot this question over to Alex. So this question is, what is the process of an existing community-based health organization that already has workers? How could they potentially get their workers to be considered CHWs?
Thank you for the question. I think it's important to clarify the importance of the recruitment process as the important piece of implementing CHWs. We're looking for people who has experience in the community, that they have they share and care about the community. They have this heart and passion to serve their own community, and definitely they have some skills that can be enhanced. So I think that's important. The piece of recruitment and actually really implementing a CHW program. Promotores program requires the engagement of the leadership of the agency to really embrace the philosophy and the principles of CHWs, because this is unique in the perspective from the community perspective, and sometimes leadership are not flexible to make changes in order to foster the growth of the CHWs. So I think involving the leadership of the agency in all of the aspects will be crucial to have a successful CHWs. And after that can come the training and supervision. But I will say those two, it will be the first thing to do as you are implementing your program.
Thanks so much, Alex. And we do have a great question as well, and I'll open it to any of the panelists that want to respond. And the question is, what is the future of CHW certification in California to ensure basic skills and clear understanding of their roles for employers?
It's a big one. And I think, as a lot of folks know, it's a controversial topic with a lot of really varied opinions around the issue of certification. Though there are individual organizations that certify within the context of their own training programs, there is not, as people know, a state recognized program of certification. And I think there've been numerous conversations over the years, but I can't say that we know or have seen that there is going to be a state certification at this point. I think one of the things that is going on contextually in the state of California right now, as many people know, is that California is considering, is going to be implementing in 2022 a state plan amendment. And one of the things that has to be examined as the state implements that new benefit in Medi-Cal is what kinds of qualifications the workforce will need to have to be billable in Medi-Cal or to be a part of the program. But I don't think we know that that's going to be certification or what that's going to look like. That is a process that is going to be decided with the input of stakeholders and in conversation with the federal government and CMS. And I can talk a little bit more about that that SPA later if folks have questions.
Great. Thank you so much, Carlina, for that. And here's a question that I think maybe Kathy, you can answer. Someone's asking specifically, if the research guide provides outcomes or objectives that California CHWs are expected to demonstrate competency on?
Not as Carlina said, there's not a specific list, a one and single only list, but there are some examples from national work on kind of key roles and responsibilities from a variety of national organizations and national work. So certainly that's a great place to start if someone's building out their own kind of list of roles and expectations with some of those guidelines as well.
Thanks, Kathy. And I have a question for Joe. So I'd love to hear, Joe, your response to our attendees' question, which was, could you please discuss the benefits of MCPs working with established CBOs who deploy CHWPs rather than hiring their own MCP workforce? For example, talking about credibility within the community.
I'm going to start with saying, education is great, experience is priceless and can't be bought or taught. So the CBOs that have community-based CHWs with established relationships in communities is like, 100-yard touchdown without throwing the ball. You have the establishment there. You're reaching a community that historically probably hasn't had insurance and very, very, very untrusting of the systems that, that we live in, and rightfully so, SATIGI, smallpox and blankets, et cetera, et cetera. We can go on and on. Those are just the ones we know of. But on that note, why should, what would be the advantage of working with an organization that's already based in the community? The answer is in the statement. They're already engrossed and based and have those relationships in the community. So utilizing those from a clinic-based community health worker, I believe is, a model that I work in and that I could speak to on experience. Those relationships, being an interpreter from the community to the clinic and clinic to the community, is priceless. And that's one thing that you'll be missing, I think, if we go through just managed care. I'm not saying managed care cannot do it. I'm just saying that, from my experience, what has worked best and evidence-based has been a community-based community health worker from the community they serve. And in my case, clinic-based. I hope I answered the question.
Joe. I think you did. Thank you, Joe, so much. And we have another great question. I think any of the panelists might want to jump into it. So this one says, coming from FQHC, where productivity is our primary financial driver, I am wondering if there is more information available on detailed and clear financial support / reimbursement for this really important work. Often that is a huge barrier for FQHC.
I can try to
We don't have anyone on the panel from an FQHC today, but I was definitely thinking back to the stakeholder process where this comment came up a lot. Is there anybody from the panel who would want to tackle this question? Or
yeah, I mean, I could just briefly, Shannon. I think the FQHC payment universe is very much in conversation at a statewide level, and specifically thinking about alternative payment and the ways that alternative payment methodologies can shift the ways that health centers engage healthcare teams and other creative mechanisms for delivering care. And that is much more of kind of a system of payment that allows our federally qualified, or would allow our federally qualified health centers to really do the things that are best for managing their patient population, rather than being so incredibly tied to the constraints of productivity and what is under the prospective payment system, in essence, a fee-for-service model. So shifting that system to give more freedom and more capability is kind of, I think, the bigger picture. And there's also a number of publications, and I think some of them are shared in the resource guide around financing. And I encourage you to check out the California Healthcare Foundation's resources on community health workers, where there's a financing paper that was actually written by Center for Healthcare Strategies that has some additional information. So plenty of resources out there, but it's a great question.
Thanks so much, Carlina. And we do have a question as well. Someone is really curious about the ROI tools that were referenced a little bit earlier. Have they been tested? If so, where? And maybe what are some potential findings?
So Kathy or Logan, do you want to talk a little bit about that since you put?
You want to take that, Logan, or do you want me to?
Sure, I'm happy to. So we really tried to first synthesize all of the evidence from the many, many studies that have been published about the impact of community health worker and promoter-led interventions. And that we have a table where we compiled all of that and really tried to break out in terms of impact on health outcomes, impact on health disparities, impact on costs. And so I'm happy to share, I will search for a link to that specific table and can share that in the chat shortly. And then we also published in the tools and resources section, and again, we can in the chat share a specific link to that, but a number of resources in our section that we developed on data collection and program measurement. We really collected a number of valuable resources related to how to calculate return on investment and how to think about developing the right strategies to make sure to, really try to estimate the return on investment that can be anticipated, and what are some of the approaches to think about in selecting one of these tools and in using these tools across return on investment as well as program evaluation. So we'll share those links and definitely encourage you to check those out.
Thanks so much, Logan. And we actually have two questions that bring up peer support specialists. And I know this is a conversation that our team has definitely engaged in before. And the question is, have you looked at integrating the work done for Medi-Cal benefit for peer support specialists, as many CHWs are cross-trained as PSS? I don't know, Shannon, I think you might want to take this one.
Yeah, I was going to say, I saw one of the questions was from Carol West around that, who, has been involved in both efforts. So they are related workforces. Both have a high level of community connection, both engage with having, a lot of lived experience. The lived experience might be different for someone who is a peer support specialist, where it's specific to mental health or possibly substance use. And we've had the conversation about, like, what is the name? Is there a name for all of this, for this entire workforce? However, I'll set that aside for a moment and just say, there is a distinction right now in the state of California around the peer support specialist position, and they've moved far ahead right now in terms of certification and preparing their training pathways from what has happened in the community health workforce. So for now, I would say I haven't seen anything that is an attempt to merge those efforts together. However, we understand that there are tremendous similarities, and I think there's a lot to be learned, from both sides in terms of the two workforces. And if you want more on that, you can put it in chat and I'll try to answer that way.
Thanks so much, Shannon. And we do have a question also, what is the conversation specifically about specialized CHWs, such as those that focus with diabetes education, PrEP, and Hep C? I don't know if anybody wants to add anything to that question.
I can jump in on that. So I think as CHWs, they have many roles that they can play, and each role needs specific skills to be developed after you recruit a heart, a passion from that. So I think there are a lot of ways to increase these skills, to enhance the skills from the workforce. So for example, diabetes or mental health, any other topic. So I think it's depending on the role of the CHW that will be playing, and can be enhanced by a training or by a peer-to-peer or like coaching on those specific areas that the CHW is gonna work in, but they can be specialized depending on the role.
Thanks so much, Alex. And one question that we have from somebody is, is there any particular way to keep CHWs motivated with their mission? And I'd love to see if Joe has an answer for motivation for the CHWs.
After doing a lot of hiring nationally, I think one of the key ingredients I look for when a community health worker is passion. And, when there's passion, that's great. And even with passion, there's caution. So with passion, self-care and making sure that, hiring correctly. Because I think when you hire from the community to serve the community, you're at an advantage. You're hiring somebody that both knows the problem, has defined it in their own lives, seen it, worked on it, and now wants to be a part of the solution for the community, right? So when we think about, taking care of yourself, self-care, it's passion, and it's hiring correctly, because I've seen clinics nationally really succeed based on who they hire as a community health worker. I'm gonna say that again. I've seen clinics, after doing this for almost a decade, succeed or fail based on who they hire. So when I look to help with hire, I look for passion. I look for networking. I look for can they build social capital? What have they been doing the last couple of years since they've been back in the community? Because a community health worker is a community health worker before they get the CHW stamp. A promotor is a promotor before they get the stamp. I think it's a given. And so on that note, to hinder that, you hire correctly, and then you also train the staff, so the staff understands the position, the clinic understands the position, so there's support. Everything else can be taught. Excel, data entry, everything else can be taught. But those basic skills, if you hire correctly, you hinder yourself from having to have that problem in the first place, and create a mechanism that has the support with an understanding that the individual comes from the community, train them around what they need to be trained, and support, and bang, bang.
Thanks so much, Joe. And Alex, I'd love for you to add anything as well to that motivation in CHWs and everything Joe said.
Yes, I think with Joe, actually, I was going to write something in the chat for him. I think one of the things also is identifying my mission in life as a CHW promoter. So after you find out, okay, this is my calling, because I believe a CHW is a calling that cannot be given in a training center or in a classroom. How do you recruit, as Joe was mentioned, is super important. Actually, by the way, some of my best CHWs in our agency, they were hired knowing with a job description. They will recruit in the laundromats or in the supermarkets or in the churches. And then, so that calling is super important. So defining your mission as in your life, and how the CHW role when you're working as that can align with your mission in life. So that's important to define your own mission, so that can keep you motivated as you go. And also putting your goals. I want to grow in this area. I want to learn more. I want to develop this area, support my community, my family. I think also is going to help motivation. Put some specific goals in your own path of growing, and that's going to help you to keep motivated. And then, thank you for the question. Great question.
Thanks, Alex. And I'll ask Carlina to add a little bit as well.
Thanks, Nayeli. Thanks so much, Alex and Joe. I also wanted to share that there's a lot of great folks on the webinar today who I'm sure have strategies and tactics to share. So if you have things that you want to share with the group, by all means, chat them in. We'd love to kind of bring your voices into the room that way. And I think Alex and Joe, like so many people, the CHW and Promotor workforce have been doing a lot in the face of the COVID pandemic. That includes a lot of the organizations who are on the line today, and that motivation and that encouragement and that support is always important, but I think all the more so as people have really dealt with all of the things that the pandemic has put upon the community. You know, and a lot of folks are from the community, and so they too are looking at and dealing with the struggles that that so many have faced in light of COVID. So just appreciate everything everyone's doing to support and motivate and encourage this important workforce.
Thanks so much, Carlina. And I know on the chat and also in the Q&A, we've actually had some questions and comments around, you know, the importance of the workforce and more than anything, trying to create quality jobs that are not underpaid, and acknowledging the fact that, you know, CHWs have been around for a really long time and obviously definitely deserve that recognition. So I don't know if any of the panelists have any input in regards to the question of what are some steps to ensure that we are creating quality jobs and not another underpaid healthcare job classification within CHWs.
I think
I just want, go ahead.
I was just going to jump in and say, you know, looking at this from the health plan's perspective, or even as a healthcare provider, it's making them an important part of the team. I think there's got to be a team approach, and looking at the CalAIM initiatives and everything that the Medicaid managed care plans are required to implement. You know, it's so important to have a complete team, and it's not just the clinician, but we need someone that can spend a lot of time, that can really relate to the patients, understand their aspects, understand the community where they come from, and the big picture, not just focus on certain healthcare questions, but to look at the big picture. I think that is the big value that they bring, to recognize that and to make them part of the entire team. I think that's what would be important in bringing the value, not just them, you know, being given certain tasks to do. It's not about doing the task, it's about the whole person approach and the whole person care and how they fit into that.
Alex, anything to add to that? Thank you so much, Lakshmi.
No, I just want to mention about the, actually right now here in the States, we are having the opportunity to really pay, and actually each CHW promoter should be getting paid. I want to mention that in the last 20, 30 years that we have been doing this work, it didn't happen before. So has been a lot of advocacy movement to recognize the CHW as part of important agent of change to really benefit our communities. I just want to give that background that is being advocating. So right now we have this discussion of, okay, let's pay, and then I'm glad the state is moving to try to consider and integrating into this workforce. But it's been a lot of work behind for many years of the work, recognizing and really elevating the voice and the work and the role of the CHWs. Definitely, they should be paying, and it's been a lot of conversations in how much those kind of things, and each county and each agency defines their own levels of payment, but they should be reimbursed. No one should be doing this work voluntarily.
Thanks so much, Alex. And I do want to make sure to ask a specific question to Carlina as well. So Carlina, you mentioned a little bit earlier, you know, California's proposed state plan amendment to add community health worker services as a Medi-Cal benefit starting on January 1st. Would you be able to briefly describe what's involved in that amendment and how the HCS is gathering comments on it?
Yeah, sure thing, Nayeli. So first, I'd say it's important to know that the implementation of the benefit has been delayed until the summer of 2022. And that has, you know, I think there's been a lot of feedback that Folks want to roll out the benefit in a thoughtful and meaningful way. And so there's more time that's needed, particularly in light of all of the other things happening in Medi-Cal right now. So there will be a little bit more time before that goes live. Secondly, the state plan amendment is going to be under what's called the preventive services rule. And the Department of Healthcare Services are currently working with stakeholders to get input on what are the sort of 4 key elements of the state plan amendment, which is supervision, qualifications, scope, and rates. And you can find out more about that stakeholder process on DHCS's website. I think Nayeli was going to chat that in for us. And then finally, and kind of ultimately, the state plan amendment has to be approved by the by CMS, by the federal government. And DHCS are consulting with them on key elements of the state plan amendment before submitting. There are only a few states that have or are developing CHW spas. And it brings up a lot of newer issues that have to be resolved and figured out, which I think is exciting and is really pushing our health systems to think differently about what a healthcare team looks like. And I think there's some other states approved or pending spas, which are posted on DHCS's website at that same link that people can check out if they're interested to know more.
Thanks so much, Carolina. And somebody did ask if you wouldn't mind repeating really quickly what you said about the summer 2022 rollout. They missed that sentence.
Yeah, sure. Just that it's being delayed until the implementation is being delayed until summer of 2022. And someone just chatted in, I saw they're working on one in Louisiana. Rhode Island is also working on a CHW spa. I believe Illinois is also working on a CHW spa. There's been a lot of federal recognition of this workforce, in part in light of all of the work that has happened during the pandemic, but it comes, as I think everybody has said, on years and years of advocacy. So hopeful that we see the nationwide trend continue and CHWs and promoters and community health representatives integrated into Medicaid in really powerful and meaningful ways.
Thank you so much, Carolina. And I know we are nearing the end of our Q&A, but I do want to make sure to get one more question out there because I think all the panelists might want to have a little bit. But, people are wondering, what is the best way to really start building a robust training program for integrating the CHWs into the clinical setting? Any suggestions and recommendations? And I know obviously our resource guide and resource center have a lot about that, but I would love to hear from the panelists. What is the one suggestion you have for people in regards to building a robust training program?
I can do my perspective. Okay, first of all, I think you should look if there is already someone doing the work of training, has been experienced developing trainings and by their own CHWs, led by the CHWs and the team. So you don't have to duplicate the work. That's my first recommendation. If there is already existing a training center that you can go and look at it or program, do it in step to like really building your own. And secondly, if you are planning to do, I think if it's from the healthcare perspective, the healthcare managed perspective, you need to include experts like the promotores, CHWs, and also people from management in order to develop your own training for your own agency. But I think there is already some other entities that has been going through the process. Maybe you can learn from them too, so you don't do the same mistakes maybe that the others did.
If I may, I would also say, if I'm a clinic thinking about expanding and hiring community health workers from the community they serve, then I would look for a training agency that actually has experts, people from the community, teaching and training other community health workers. So that way we know that they're being, historically, these jobs don't always go to community health workers. Historically, these jobs have been for nurses and other people, waiting, and I always use Minnesota as my example. No offense to Minnesota, but, somebody from Minnesota has never been hungry or, doesn't understand somebody being shot in front of their house and kids eating, Cheetos and Pepsi for breakfast and just has no understanding of that, really cannot be a community health worker in my community. So, just thinking back, if you're looking for a training, look for an agency that's from the community, an agency that, they're experts and teachers and trainers are actually been in the field, have their feet wet, understand the need, and maybe they've even been hungry. One person can teach you about hunger out of a book, and then I can tell you about hunger. Who do you think is going to do it better?
So with that, there's no one who's going to be able to top that response. And I think we're all just saying yes, 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 right? This is a point of passion. You can hear it in everybody who's on the panel today. We were really fortunate to have a marvelous group of stakeholders that contributed throughout this process, very passionate advocates for the workforce and for health equity as a whole. So I just want to thank all of you for participating, both in the project and also, in today's webinar. And Carlina, I'm going to transition it over to you. We've got one final slide, and so that we can wrap up today.
Great. Thanks so much, Shannon. And just want to echo your appreciations for everyone that's joined us today and also all of the people that participated in the project, several of whom I know are listening. So just three things, three ways that I hope you all will stay engaged in this work. First is to stay tuned. California Healthcare Foundation will be launching the next phase of this work in early 2022. We plan to support 4 regions in California that are seeking to expand their community health worker and promotor workforce in the context of Medi-Cal. We plan to issue a letter of intent with further guidance later this year, so please keep your eyes out. Secondly, keep in touch. Please sign up for the email list. It's where you will get the LOI announcement. I think that was just put into the chat. Or other project-related information. Also, please reach out and let us know if there are initiatives or issues you want us to be aware of as it relates to this workforce. And finally, visit the Resource Center. We have been able to share just a little bit about what it has to offer. So I hope that you all feel encouraged to dig deeper and learn more, and most importantly, that you use the resources to advance your work with community health workers and promotores. Thank you all so much for joining us today, and thank you for the wonderful work that you do to improve the health of Californians.
It's an official wrap. Bye all.